Hi, my name is Savannah. I'm going to be doing my accessing a mediport skill today. First things first, I'm going to make sure I follow all my GPSPs, my 11 rights, my 3 checks. I'm going to make sure that I identify my patient using 2 patient identifiers. I'm going to make sure I identify myself to the patient, and I'm going to make sure to explain the procedure before we start. So the first things first is I'm going to provide a mask for me and my patient. My patient obviously already has one on. Mask is on. So I'm going to perform hand hygiene and put on some clean gloves. Once I have my clean gloves on, I'm going to go ahead and assess the mediport site. I'm going to just kind of palpate the location and just make sure there's no redness or signs of infection or anything like that. Okay, seems like there are no problems. I'm then going to go ahead and open up my sterile kit. Now I'm going to remove my gloves, perform hand hygiene, and now I'm going to put on sterile gloves. So now I'm going to go ahead and take my cleanser, my floor prep, and I'm going to clean the area for at least 30 seconds. Oops. Making sure I do back and forth motions. And then I'm going to let that, allow that to dry naturally, making sure to not touch, blow, or fan the area. So I'm then going to go ahead and get my needle ready. So I'm now going to stabilize the mediport, and this hand is now not sterile. I'm then going to, with my non-dominant hand, insert the mediport. I'm then going to clamp. And I'm going to make sure I scrub the hub. And then going to take my normal saline. And unclamp. Make sure it's unclamped, both of them. I'm then going to flush a little bit of my normal saline. I'm going to make sure there are no leaks coming out from around the insertion site. And then once I flush a little bit and make sure there are no leaks, I'm then going to retract a little bit, or aspirate a little bit to make sure that we have positive blood return. If we have positive blood return, then I'm going to go ahead and finish giving the rest of the medication using the push-pulse technique. After I would finish giving my medication, I would then scrub the hub again, and I would put on a green sanitation cap on the end. I don't have one, but that's what I would do there. I would clamp it and then make sure I did that. Then after that, I would go ahead and apply a new dressing. After I applied the dressing, I would make sure to just assess my patient to make sure that there were no issues with the medication. I would then date and time and initial my dressing, and I would make sure to report and record everything that I have done.